Jesse Gutnick. I'm one of the bariatric and weight loss surgeons within the Cleveland Clinic Health System. We've got a great live surgery seminar today. The panelists are myself, Jamie Sarver. She's both a patient and is also one of the managers of our program, and then Dr. Feng, who's another one of the bariatric medical weight loss surgeons. So to give you an idea about this is going to happen over around 30 to 40 minutes, and then we'll have some time for questions. First, we're going to hear Jamie's personal story. I'm going to talk about the effectiveness of weight loss surgery. Dr. Feng is going to talk about the safety of weight loss surgery. I'm going to talk a little bit about the nuts and bolts of the program, and then we'll do our Q&A. Feel free to send in questions at any time through the chat box. I see some people have already been typing in there. And we will answer them at the end, but feel free to submit them as we go. And with that, I'd like to kick it off with your Jamie's story.
Hi, everybody. Hi, my name is Jamie Sarver. I'm one of the nurses that works at the BMI with the obesity medicine team, and I also am a program coordinator for the BMI in general, just doing kind of everything. I started working here at Cleveland Clinic about 6 years ago, and 3 years ago I had bariatric surgery, but prior to that I had a little bit of my own weight loss journey, and it's still continuing to this day. And so I just wanted to make sure I share my story and help anybody else that might be kind of struggling with what options to choose from and what to do as far as bariatric surgery. So next slide. So here you can see on the left-hand side, this was me at one of my highest weights ever back in September of 2019. And then 1 year later, that was shortly after surgery, about 9 months after surgery. That is my surgeon, Dr. John Rodriguez. And then you see me again at about 2 years post-op with my surgeon again. So each time I see him, I try to get another picture with him just so that it can kind of help share my growth and my progression throughout my weight loss journey. Next slide. So I also like to give people a little bit of information about what kind of drove me to having bariatric surgery. So I have some pre-surgical information I'll discuss, and then some post-surgical information I'll discuss. So prior to bariatric surgery, at the time of surgery, I was about 34 years old. My highest weight was 253 pounds. I really didn't have significant comorbid conditions. So those are like those diagnoses like diabetes or hypertension or anything like that. But I did have very severe PCOS, which is polycystic ovarian syndrome. And I also had infertility. And then I also have a strong family history of obesity. So my, especially on my maternal side. So my maternal side, there is diabetes. And so I kind of knew that this is something that if I didn't take care of it soon, then this is going to progress to becoming a problem potentially for me. And I also saw my mom struggle all of my life with obesity. And so I just knew as I was getting older and as I was kind of starting to already feel those aches and pains of and the insecurities just from having my own struggle with it, I felt like it was time for me to really just kind of take charge of my situation and just kind of move forward with that. I also had considered bariatric surgery prior to even starting working at this department, but it was something that was kind of like remote and far off. I didn't really know how to even access that information or access that tool or work with my insurance company and see if that's even an option. And I also didn't like really know where to go. And so I really just had mostly worked with diet and lifestyle interventions. However, no matter what I would try, it would work for a little bit and I'd lose about 20 pounds. Usually that was my max. And then it would, you know, I would stall and I would maybe hold the 20 pounds of weight loss for a little bit. And then I would start to see that weight slowly creep back up. And so for me, I just kind of felt defeated every single time that I tried. And that's why once I got to my highest weight, it was like, I'm done trying to struggle with this. I'm ready to just move forward with something that I know is going to be durable and long lasting. And so I went ahead and had the gastric bypass procedure on December 13th, 2019. My weight the day before surgery was 233 pounds. And then as of today, I kind of fluctuate between 120 pounds and 125 pounds. It just kind of depends on the day. But now I'm not really like looking at the scale. I don't really worry about what my weight is on a regular basis, just because I'm so happy with my progress that I am not focused on that kind of a thing anymore. My time in surgery was about an hour and 20 minutes. And I spent about a day and a half in the hospital. That's going to be different for each patient. But for me, it was about a day, 1.5 days. And that includes the time that I like literally walked in the door before surgery to the minute I was being wheeled out of the hospital. It took me about 3 days of initial, like, oh my goodness, I just had surgery. That was the kind of pain that you felt like initially, where you just really needed to get your rest and you needed to be doing your fluids and taking some pain medicine, staying on top of that. But then after that 3 days was over, I was totally fine. The whole entire time though, I was able to move around. I was up and down stairs. The house that I was living in, I had 4 flights of stairs and my room was on the top floor. So I was able to really still move around and really able to still do the things that I needed to do. But when I got, tired or things like that, I just knew I needed to rest a little bit more. And like I said, I was moving and walking pretty well within 3 days. And then in 4 weeks, I was actually back to work with no problems whatsoever. And I've had no problems since then. Next slide. So I like to also just kind of show my weight graph. So you'll see here, this is actually the whole 5 years about that I've been working in this department and been a patient of our institute. And you can see like my starting weight there was just under 250 pounds. I did have a little dip in my weight prior to bariatric surgery, where I was on medications and things like that, where I had lost some weight and they were not as effective. And so I wound up gaining weight again, got up to that highest weight again, the 253 pounds. And then you can see I continued to progress and wound up having bariatric surgery. And then you can see 6 months post-operatively, I had that biggest definition in the curve going down. And then at 1 year post-op, it continued. And at 2 years, by the time I got between 1 year and 2 years post-op, you can see it kind of plateaus a little bit. And I was at like a healthy, stable weight. And then I started making some changes. And now you can see again, I've had another drop in my weight. And so this is just kind of me showing you my success over the last 3 years since bariatric surgery. Next slide. So another thing I like to discuss is just some post-op milestones that are really important for people, like I feel that are important for me to share to people as they're kind of progressing or going through or getting really close to having bariatric surgery, just kind of like what to expect or what's normal. So at 2 to 4 weeks post-op, you're still going to be on a liquid diet. And the majority of your nutrition is going to be coming through protein shakes. And so that can get kind of old. I know beforehand as well, like 2 weeks before, most patients are directed to do a very low calorie diet, which is also a liquid diet, and it's mostly protein shakes as well. So you're on protein shakes as your main nutrition source for about a month. And so by the end of that, you're really sick of protein shakes. And so that's a little bit difficult, but you know that that's important for you to still maintain your nutrition. And so, you just kind of got to work with it. And then also at 2 to 4 weeks, you're working on reaching at least your protein goal or your water goal. One of those daily is going to be important. For me, I focused on making sure that I was reaching my water goals daily. And then obviously with the protein shakes, that was also including my protein, but also that's fluid. So I was kind of trying to focus on that. And then getting moving. My surgeon cleared me at 4 weeks to start exercising and things like that. So, but you can still walk around and things like that. So every day I was making sure that I was getting up. I was starting to develop my routines, like the new routines, like making sure that I'm monitoring how much water I'm getting, making sure that I'm taking my vitamin daily, so that those were already kind of ingrained in my system before I went back to work and went back to like my previous kind of like everyday rush kind of lifestyle. My surgical pain by this point was also like not even there. It was the most I was having was if I was like bending over or if I was doing something you're really not supposed to be lifting more than like I believe it's like 10 to 15 pounds. And so, you know, if you're still moving and doing your activities, you could have a little bit of that like slight pains, but I just would take the Tylenol and I was fine. At 1 to 3 months post-op, you're pretty much hitting your protein and your water goals every single day. If you're not, you kind of know what you did for that day, or you were distracted, or you weren't kind of focusing on yourself. And then your weight loss is actually by this point really starting to become noticeable. Like I showed you on my graph, up to that 6 month is where you're having the majority of your weight loss. And so for you will see that during that time, that's the most rapid amount, and people are noticing and you're noticing. So every time you look at yourself in the mirror, you're like, oh my gosh, my face looks different just from yesterday, or this outfit doesn't fit me anymore. It's very rapid during that time. At 3 to 6 months post-op, I think that this was one of the biggest turnaround things for me, because food was finally my friend again. I was finally able to like have some enjoyment of food where I wasn't like feeling like, oh my gosh, I'm just eating so that I don't get malnourished. I'm just eating to get these protein goals in. Now I can actually enjoy eating something and I don't feel like overly full, that kind of a thing. And so for me, that was really big change. And plus I was able to start incorporating some of those other things that like you're kind of supposed to stay away from for the first 3 months. And then also you're still really losing your weight at a really good pace. And then I also noticed my activity level just was going through the roof. I mean, I came from floor nursing and working on the floor, and I beforehand would come home and my feet would be so sore or so tired and just, you know, not able to really do all that stuff. By the time I was 3 to 6 months out, I was able to like walk up and down stairs. I was able to do stuff that I really hadn't been doing in a while because of just how much pain it would cause me, or I would just be, you know, tired out from doing those things. So I could really see that activity level change. And then at 6 to 12 months post-op, this is when you've kind of reached the most amount of your weight loss. And it starts kind of slowing down a little bit. You still can be losing weight afterwards, but the majority of that like weight has come off by that point. Again, I'm hitting my protein and water goals every single day. That was like my main focus. You also, like, I noticed a lot of changes in my confidence levels, just in the way that I wasn't like shy or like standoffish with like speaking my mind or saying things or things like that. For me, I kind of noticed that change at that point. And then even in my relationship with my husband, he's been supportive this entire time. But even him, like his mindset, he didn't care whether or not I had surgery or not. But I always like to share, like, even him, he kind of like realized like, oh my gosh, my wife has like really improved in her confidence. She's really made some significant changes. He started getting healthier. He lost weight. But then also even the way that like we would be out in public and we would see people and he'd be like, look at Jamie, doesn't she look amazing? Doesn't she look great? Like those types of things. Those were some significant changes that me and my husband kind of experienced during that time. And then I also like to just comment on like, there's non-measurable goals. So even if you don't lose, a significant amount, or you don't feel like you're losing weight, there's things that like were changing for me, that like just getting out of the bed or being able to stand up and balance on one foot. It was such a change that I experienced during that time, that there were things that I realized, like, I haven't been doing these things and now I can do them. And this is awesome. Next slide. So now that I'm closer to the 3 years, or I am 3 years post-op, I kind of like to talk about like, how do I maintain this weight loss? And so there are some things that are really important to still keep track of and still continue to do once you get past that 1 year, especially if you want to continue to like maintain that investment. I call it an investment in myself. And so maintaining that is important. So I'm still mindful of the sugar and protein and water intake on a daily basis. Every single day, I'm having some sort of extra protein supplement. So whether it's a protein bar or a protein shake, or they have like yogurt that's got a higher amount of protein in it. I'm very mindful of like making sure that I'm still getting my protein goal in. I'm still mindful of making sure that I get my water in every single day. But then I also kind of still monitor how much sugar is in the things that I'm taking in, just because it can make me feel a little bit ill or sick. And we'll talk about that more, I'm sure, in the Q&A. But those types of things I just am really careful of still. Also exercising. I have another slide that I'm going to show a picture of, but I, as a caregiver here, we always talk about how exercise is so important to get started right away. It helps with the loose skin. It helps with all of these types of things. And I really didn't do that. I kind of rode the like, oh my gosh, I'm losing all this weight within the first 6 months. This is amazing. And then once I started plateauing, I was like, oh no, like, what am I going to do? I'm doing everything else. And then I realized I'm not doing structured exercise, or I'm not doing real exercise. And as soon as I started incorporating that, I recognized that change immediately. And so many times now, I'm like, I wish I would have told people to be exercising more frequently. And then also the other important things are continuing your daily vitamins. You do need to take vitamins every single day, just so that you can maintain that vitamin stores and just not worry about any of those vitamin deficiencies that you can get. But I was already taking a vitamin beforehand, so that wasn't really a big change for me. And then also keeping up with your post-op appointments. I still, every year, you have an annual follow-up. I get my labs done. I, get checked to make sure that there's no additional problems, and that, it's a way to just update my providers on my progress, so that they know I'm still doing a good job and maintaining that weight loss, in case that there's a plateau or some sort of issue where, maybe down the road I'm starting to gain weight or something like that. It's not as big of a deal if I've only gained 5 or 6 pounds as opposed to, 20 to 30 pounds of weight gain. So next slide. So this is the picture that I like to kind of share with everybody, that kind of shows like the difference in exercise versus not exercising after bariatric surgery. So like I said, I had gastric bypass in December of 2019, and you can see about 6 months later in the summer, I had lost quite a bit of weight. But I was not exercising. I was still between 165 to 170 pounds. But I really just didn't have that like tone and things like that. And so I began exercising because I had hit that plateau, mostly doing weight resistance training with some cardio. And I don't have a gym membership. I did all this at home. And so for me, it was just like making sure that I'm like taking breaks. Like if I go down to do laundry, I was doing some weights or things like that. And then in the summer of 2021, you can see here, like I didn't have any kind of surgical procedure, but for the first time in 16 years of struggling whenever I would go and exercise and not even seeing a change at all. Now you can see I have like abs and I have biceps and things like that, where it's like, oh my gosh, like I can finally actually see there's a dent, a progress made actually by exercising. So I try to just make sure everybody knows it's really important to start exercising as soon as you possibly can. I believe that's it for my slides. So just thank you everybody for hearing my story, and I hope that that helps you to make your decision on what bariatric surgery or your surgical journey as well.
Thank you, Jamie. I'm going to kick off the next slide, and I saw that some people send some questions in for her, which we'll get to. She'll answer for you at the end, and please feel free to keep sending more in. I'm going to talk about how it works. Essentially, your whole body is designed to almost have a weight thermostat, similar to the thermostat in your house, where if your weight is going up, it has measures to keep it down. If it's going down, it tries to bring it back up. And that thermostat slowly goes up over your life. So as you're from being young to being old, it becomes harder to lose weight. When you diet, your body fights that weight loss by changing your hormonal balances so that you actually use your energy more efficiently and retain whatever calories you take in your body. What's different from weight loss surgery, and actually different from weight loss medications, is that it reprograms your body how to manage food. That reprogramming is the strongest in the first 2 years, and that's why the majority of the weight loss is in the first couple of years. but it persists for years afterwards. It's just not quite as strong. And basically, it doesn't just restrict the amount of food you're eating, although there is some element of that, but it reprograms how you use the food that you are eating so that you lose weight. So on a more detailed level, one of the big things is something called your basal energy expenditure. That's just how much energy you burn when you're not doing any particular activity, like I'm sitting here now talking to you. When you're dieting, your body turns that energy expenditure down, becomes more efficient. After bariatric surgery, that basal energy expenditure goes up. Your sensation of appetite or hunger increases when you're dieting. Your satiety or your fullness decreases, and the opposite of that's true with bariatric surgery. When you're dieting, your stress hormones go up, and they go down with bariatric surgery. And then there's a lot of gut hormones that are involved in bariatric surgery. One you might notice here is GLP-1. You may have heard of the newest weight loss medications like Mounjaro, and those increase your GLP-1 similar to bariatric surgery. But the reason that we think that we see long-term success with surgery is, number one, it's permanent, so you don't have to keep taking medication, but also works through a lot of additional medications like your bile acids in your blood, PYY, and other hormones. I'm going to talk about two of the surgical options in depth, which are the sleeve gastrectomy and the gastric bypass, because that's about what 90% of people get is one of these two. We also offer duodenal switch surgery and revisional surgery, both for weight regain, but also corrective if there's an issue with someone's prior surgery. Those I'm going to talk about in less detail. So to familiarize you with the surgeries, the gastric bypass is a stomach bypass. It's on the right-hand side of your screen. Most of the stomach's bypassed, and the food goes right from a small pouch at the top of your stomach into the small intestine. And it works both by being a smaller pouch, so you eat less physically, but also by bypassing that first part of the small intestine and the stomach, it has those hormonal changes. The second one is the sleeve gastrectomy, which is on the right-hand side, where we change the shape and size of your stomach to about the size of a banana from about the size of the small purse. But importantly, we're taking out a part that expands with a meal called your fundus, and that's also a hormonally active part. We've done a lot of groundbreaking research over the last 20 years, and one of them that's most important was looking not just at weight loss, because we've known for many, many years that it's very effective for weight loss, but also how weight loss surgery affects the other health issues that come with obesity, in particular diabetes, because diabetes can be one of the most devastating of all other health issues. And so this was what's called a randomized controlled trial, which is the highest level of evidence that we use when studying medical issues on looking at not just weight loss, but also diabetes treatment in people that were randomized to getting surgery or best medical care. And it followed people for 5 years afterwards, and it was conducted at this institution. So in the yellow line, that's the people out of the best medical care. In the gastric bypass, patients are in the orange line, and the patients who have the sleeve were in the blue line. As you can see, this is weight loss, and it looks at the change in the BMI over the years, starting on the left-hand side of the day of surgery or the date of enrolling into the medical therapy, or to 60 months. A rapid weight loss decline of about 10 BMI points for gastric bypass and about 9 BMI points for the sleeve, with a gradual and gentle adjustment upwards over time, which is actually what you see if you follow people who haven't had any surgery over time. And then the people with the best medical weight loss, they had a modest improvement in their BMI over time, about 2 points. But where you really see the difference is over that 5 years, what happens to their A1C. And if you're a diabetic or you know someone who is, this is that important lab that your doctors check to see how well your sugars are controlled. And if you look at the gastric bypass and the sleeve, they had a really impressive decrease in their A1C of about 3 points. And that persisted over time. It ended up being around 2.5 points at the end of the 5 years, compared to the best medical therapy, where they had initial improvement, but it came right back up to their baseline, essentially. These patients also, on average, halved or more than halved the number of anti-diabetic medications they were on. Well, in addition to this improvement in their A1C, it was on less medications. So similar to the diabetes, weight loss surgery affects every aspect of your health that can be affected by obesity. Some of the more common ones are listed here: heartburn, arthritis, diabetes, heart and lung issues, etc. And the idea, hopefully, is if you are fortunate enough not to suffer from any of these, to prevent them from happening. But if you do have any of them, to stabilize or even for many of them reverse these problems and put diabetes into remission along with these other issues. With that, I'm going to turn things over to Dr. Feng to talk about the safety.
Hi, everyone. Thank you so much for jumping on the video conference with us. My name is Dr. Feng. I work out of main campus. I do minimally invasive bariatric surgery, both robotic and laparoscopic. And I'm going to be talking about the safety of weight loss surgery, which I think is a topic that many, even other medical providers, are not as up to date on the most current information that we have. Next slide. So how do we measure safety? I think in terms of surgical procedures, we have to consider safety with regards to the benefits that you would get from that procedure, because no procedure, no matter how small or simple, to larger, complex, or long, is without risk. So there's two components that we're going to discuss. We're going to look at some slides looking at the risks of surgery, which hopefully I will show to you guys are small, comparable to how much is being done, and that the health benefits, the outcomes that you get after surgery tend to be very large and life-changing oftentimes. Next slide, please. So this was a study done at our institution. Dr. Aminian was the lead author, and it was looking at, it was using a national quality, a surgical quality database. So it included information from all of these different surgeries and then some performed at hospitals nationwide in the US. And it looked at the safety in terms of the rates of complications, major complications within 30 days of all of the left-sided listed procedures. So CABG up there stands for open heart surgery, something that you may know some family members or friends who have had. Okay, bypass operations, that would be for heart and blood vessel disease, excuse me. Knee arthroplasty, colon operations, appendix operations, cholecystectomy means removal of your gallbladder, and hysterectomy means removal of the uterus. And then at the very bottom, we have lat Roux-en-Y gastric bypass. So basically, the bars that you see across the screen are the 30-day. It was a composite measure of, so like a combined measure of complications within 30 days. And as you can see, gastric bypass was 3.4%. So it had about the same rate of complications as getting your gallbladder removed or getting a hysterectomy. What's not shown on this slide here are mortality rates. That would mean rates of dying from the surgery. And again, found in the same study, although not shown on this slide, is the rates of mortality after a gastric bypass was 0.3%. So that was actually the same as a knee arthroplasty. So that is, one more recent study that came out. Next slide, please. This slide is showing that as we have gotten better and better at doing these surgeries, the complication rates as well as the mortality rates have decreased. So back in 2002, which is the far left side of the screen with the where the left-sided line is, you can see that there were 4 deaths per 1,000 patients. And that's looking at in-hospital mortality from bariatric surgery. And towards the end of the study, and again, this is somewhat outdated because this is 2009 data, but the point of this slide is to show the general trend, which is that we have gotten better and safer at doing these surgeries. In the vast majority of cases, we are doing these all minimally invasive. So that means traditional laparoscopic or robotic surgery. And of course, here at the Cleveland Clinic, we are a center of excellence. So the American Society for Metabolic and Bariatric Surgery, that means they monitor all of our outcomes for quality assurance. They look at our complication rates, they look at our mortality rates, they look at all of a whole multitude of factors to make sure that we, as like other centers of excellence for bariatric surgery, stay on track. And so we definitely participate in that here. And in fact, a lot of our research studies use that anonymized data. So next slide, please. So we covered a little bit about the risks of surgery, both in complications and mortality rates. We see that those tend to be obviously not zero, but low and something comparable to other common surgeries that we see, like having gallbladder removed, having a hysterectomy. But what are the actual gains that we get if we take on this risk? So this is one study also from our institution that compared patients with a disease of obesity as well as type 2 diabetes, which is also very common and afflicts many of our patients. And they looked at over time what kind of heart outcomes they had. So of course here, you know, we don't want to just fix your quote unquote BMI. That's just a number. We want our patients to have a healthier life, better quality of life, with, you know, less medical disease burden. So it was important in this study to look at, you know, what are the actual health problems that were solved or not solved with bariatric surgery. And so they looked at, next slide, please. They looked at heart failure, coronary artery disease, or, you know, heart disease, heart arrhythmias, that means funny rhythms like atrial fibrillation, stroke, kidney disease, high blood pressure. And they found that overall, over a period of 8 years, patients who underwent bariatric surgery had an 8% lower risk of death than patients who did not get surgery, just got the usual care for their the obesity and the type 2 diabetes. So in the world of scientific literature and scientific research, that is not a small deal at all. It's hard to find, you know, many medications that can lead to such a difference, especially in terms of lifespan or, you know, survival, quote unquote, benefit. Next slide, please. Moreover, not only did we find that, you know, people tend to live longer, we also anticipate that patients will most likely have a better quality of life. Because with the weight loss, you know, there is a higher chance of treating sleep apnea, either having the diabetes go into remission or becoming easier to control, having less insulin requirements. Many people have better fertility rates afterwards. Quality of life can also increase due to, you know, less burden on the joints. There's a decreased risk of certain type of obesity-related cancers. There's, I don't have a separate slide for this, but our group also came out with a study just last year, and it was covered widely by the media, that based on a review of all of our charts, bariatric surgery was associated with a lower risk of developing several types of obesity-related cancers, actually 7. And moreover, it was associated with a 48% lower risk of dying from those cancer-related issues. So that, again, is also not a small difference. It is also more effective, actually, because we don't have any other medical treatments for fatty liver disease, but bariatric surgery is also associated with remission or improvement, at least, of fatty liver disease. So all that said, you know, it's not that, again, we're not trying to fix the number. We're not trying to treat, quote unquote, the BMI. We're trying to, you know, help get the other medical problems under control, give you a longer life, as well as a more higher quality of life. Next slide, please. And lastly, I just wanted to mention, we also looked at some research that around when the COVID pandemic was happening. And I'll just briefly say that, our studies found that people with the disease of obesity tended to have a higher rate of hospitalization when they came down with COVID, and that it did put them at risk for higher mortality rates, for more severe COVID infections when they did get COVID. And thankfully, that if you had bariatric surgery, with that weight loss, people tended to do better and have better outcomes, even if they got COVID. Next slide, please. And with that, I'm going to turn it back over to Dr. Gutnick, who's going to talk a little bit about our program in particular, and I'll be happy to answer any questions towards the end.
Thank you. And just as a reminder to people, I'm glad that you sent in some more questions, and we will roll over to all of them soon. So I want to talk a little bit about the nuts and bolts of how our program works and actually answer one of the questions. One of the questions was, are all of your places centers of excellence? And they certainly are. We have 3 locations, with one coming soon, all of which are ASMBS certified centers of excellence. And they're all examined by the ASMBS as separate. Even though we're one program, they're examined separately because the way that certifying body does it is they do it by particular hospital, even if you're all part of one program. So because we have the 3 locations, we can care for you closer to home. Centrally in Northeast Ohio at main campus, on the west side at Fairview, on the east side at Hillcrest, and with our new Mentor Hospital opening, that area will be coming soon. We also have extensive virtual visits, whether you're in town or out of town. For many patients, you can get almost all or even all of your preoperative appointments virtually. And that in particular is helpful for patients that are traveling from further away. The institution in general and all of these hospitals are nationally and highly ranked, and ranked very, very highly within the state of Ohio. The DDSI, or the Digestive Disease and Surgery Institute that we're part of, was ranked #1 in Ohio and #3 nationally this past year. Main campus is consistently #1 in Ohio and #2 nationally. Fairview and Hillcrest are ranked as the #4 and 5 hospitals within Ohio. So no matter where you choose, and this is based on the U.S. News and World Report, which is highly based on safety data, you're at a great place. We assign each patient a navigator. And as you may know, if you've already looked into this at another program or looked into it with your own insurance company, moving through the insurance, jumping through their loopholes can be quite a task. And the purpose of your navigator is to help you navigate through those insurance requirements, which vary greatly from person to person, depending on what type of insurance you have. The navigator is there to help with that. Then another question that was asked earlier was, does all of your doctors need to sign off on you having surgery? The answer is no. The way it works is you're evaluated by a specialist group of medical providers, bariatric surgeon, like Dr. Feng or myself, an obesity medicine professional. They're people that have two roles. One is making sure that you're medically safe for surgery, and if you're not, helping you get there. The other is they also do obesity medical treatments for people that are not interested in surgery or may not be candidates. They also do medication for weight loss. The bariatric psychologists, they are there both to fulfill an insurance requirement that everyone has for a psychological evaluation, but they're also really there just to help make sure you're well prepared for a big change. And then some people, but not everybody, need extra consultants. For example, most commonly, sleep medicine if you have undiagnosed sleep apnea, cardiology, etc. All of your doctors don't have to sign off on it, but this group that sees you do have to sign off that it is a safe thing to do and that you'll benefit from it. So in summary, why does bariatric surgery work? Severe obesity is a metabolic disease. And when you are suffering from obesity, your calorie needs are low, your set point's high. Dieting has short-term results. As far as we know so far, medications only have short-term results. But surgery combined with diet and exercise is the only thing we know of that has a long-term track record of success. And I think if, just to sum it up, think about what Dr. Feng talked about for just 1 second, and those graphs and the huge separation. One of the reasons that I got into bariatric surgery, of any of the fields that I've talked to almost any bariatric surgeon, and I'm sure they'll say the same thing, is this is totally unlike any other area of surgery in terms of the effects that we're able to have. If you look at the graphs from medical publications, the lines are often really close together. And just, you can see with that visual thing, the difference that it makes. And with that, we're going to move into our question and answer phase. I'm going to moderate it and ask Dr. Feng and Ms. Sarver the questions. I'll answer some of them myself. Continue to send them into the chat and send them to all the panelists so we can see them all. While you're doing that, one of the common questions is, what's the next step? So I'll answer that with this slide that you can read while we're going through each of the questions. So, to start, as always, Jamie gets quite a few questions. Jamie, obviously you both work for our department, and we chose you because you're a good spokesperson, because you're very articulate about your own journey. But did you have any moments of regret or self-doubt as you went through? That was one of the early questions along the way. Jamie, were you able to hear me?
Jamie, can you hear us?
She might have a connect.
I think you're muted. We can't hear you.
Sorry, my connection did run out. So I'm sorry, I did not hear that question.
Oh, obviously we chose you because, you're very articulate about your own personal journey, and it's a very inspiring one. And it brings together a lot of the things like, medications, surgery, exercise. But one of the persons asked, did you have any moments of self-doubt or regret along the way? Sort of more that emotional side of going through your journey.
Yeah, so I actually didn't. From the moment I decided I'm going to move forward with this, was kind of at that point where I was like, I have tried every single possible avenue of doing this on my own. I have a family history that is always going to be against me. There's always going to be something there, and I'm sick of having to fight and do this on my own. And so for me, it was kind of like one of those moments where I was like, I'm done fighting, and I need help, and I need a bigger drill in the toolbox, essentially. And so for me, that was why I personally made that decision to have the gastric bypass and have a procedure that I knew was going to help me every step of the way and throughout the longest amount of time. Even if I was going to be on medications or not, I needed something that was also going to be there to help me make those permanent changes.
Dr. Feng, can you talk a little bit about protein and water goals? There's several questions about what they are, how do you set them, how do you meet them, that kind of thing.
Yeah, sure. So as Dr. Gutnick mentioned, one of our required visits is a visit with our one of our dietitians / nutritionists, and they go through a very careful history with you. They talk about the weight that you're currently at, and with calculations, they calculate your personal daily protein intake requirement. That will help in both the preoperative period, and then you might have a separate one for the postoperative, i.e. After surgical period. In general, that's going to, again, vary based on your weight. It is after surgery, it's about 60 grams, if not higher. Okay, so it can certainly be higher. In terms of water goals, we ask that our patients after surgery hit or come close to 64 ounces of fluids. I did see a question in the chat box on how do you hold that much water or protein, when you the size of your stomach is obviously drastically different. And something that we stress to all of our patients beforehand as part of their preoperative education is you can certainly, you can't wait until you are thirsty and really, really dehydrated to chug a whole bunch of water, because that will not work. One of the biggest adjustments after surgery is drinking throughout the day. So you have to be constantly sipping, because it's true, you don't have that reservoir anymore. However, patients should be able to get that down. Of course, it's hard in the first couple of days after surgery, but people get the hang of it and people do really, really well. So it's a learning process. As my nurse often tells our patients, it's kind of like being a baby again. But people catch on very quickly. Our patients tend to do very well with that once they get the hang of it.
Great. Dr. Feng, could you also maybe talk on, one of the studies I showed, so the Stampede trial showed about a 9 BMI point loss for the sleeve and 10 for the gastric bypass. Can you talk about, how they compare, and also maybe do a needle switch, maybe also about how the heterogeneity and the diet, like that's not necessarily the number I'd hang my hat on, but that was a particular subgroup of patients.
Are you asking about just the differences?
Yeah, just like the amount of weight
between
loss, I guess, between them and how they compare. That was one of
Yeah, so the sleeve gastrectomy, otherwise called the vertical sleeve gastrectomy, is the most common procedure. It accounts for probably 2/3 of procedures done in the US. And you, on average, get about 20 to 25% total weight loss with that. So if that's an easier way to think about it instead of BMI points, that's often what I quote to my patients. The gastric bypass will get you on average more weight loss than that, so about 30 to 35%. And lastly, the duodenal switch, which you can kind of think of it as almost a combination of a sleeve and a bypass, because it's a sleeve on the top of the stomach area, and then you are bypassing more of the small intestine. That gets you 45 to 50% excess weight loss. However, that is the least commonly performed procedure because it does come with slightly higher risks of vitamin issues after surgery. And if you're interested in that, that is definitely something you have to talk very carefully with your surgeon about. So I recommend bringing that up at your surgeon visit, okay? But those are kind of the general estimates that we quote most of our patients. But keep in mind, the surgical the choice of surgery is, highly individualized. It's not one size fits all. And it's certainly not, oh, I want this much weight loss, so I'm going to go with this procedure. We have to take into account many other things like your other medical problems, in addition to your weight loss goals and your expectations after surgery, a whole host of factors. And that is the majority of what I would say comprises your discussion with your surgeon. And so if you have, specific concerns, definitely that is what me and Dr. Gutnick are here for.
Perfect. I'm gonna answer some skin questions, which are some of the most common ones. There were some to you, Jamie, like, did you have to deal with any of that? I think you're a good example of why we recommend exercise, not just for the best weight loss outcome, but for also, skin removal and maybe avoiding that. Sorry, I think you're.
I'm sorry. Did you? I wasn't sure if you were going to answer that or if you wanted me to speak on
No, I want to your personal perspective. You also obviously speak with a lot of our patients. And
Yeah.
I'm going to give a little from the surgical perspective as well.
Yeah. So for me, I had a BMI between, I think I was around 45, which was my highest BMI. And so I really did not have the need to have any kind of skin removal surgery. I still don't really have excess or hanging skin. So it's really not a significant problem for many of our patients. However, some people do choose to have some skin removal surgery, such as like the abdominoplasty or some of the skin removal from like the arms and legs or something like that. It's usually not covered by your insurance, but if you're having real significant issues, sometimes the surgeons in plastic surgery department are able to, add those types of things into their note for like a rationale of why it might be necessary or medically necessary. But for myself personally, I did not have that. And part of the reason why was actually a lot of that weight resistance training that I did. I was kind of replacing some of that fat that I was losing in my arms and my legs with muscle. instead. And so my skin was also, I'm younger, I was 34, so I kind of had a little bit more of that elasticity. So I do know that I'm kind of like one of those ones that's in that fortunate area where I didn't have to worry about that. But I know that there are people that struggle, but in that BMI range, that 45 to 50, usually it's not something that we're experiencing that often, that people are really needing that skin removal.
Yeah, and I'll say it's one of those common questions that I get asked, and again, because it's a legitimate concern. It's also one of the least common things that people feel that's necessary to do. As Jamie said, especially in the arms and the legs, which are some of the most frequent areas of concern. The good news is that the weight resistance training helps more there. The place that often helps a little bit less is in the stomach area. And a lot of that has to do with how you carry your weight now. Some people tend to carry more weight on their stomach, and they might be at a little bit more risk for some excess skin there. Other people really carry it more other places like legs or something like that, and then you may have a little bit less risk of that. Some people asked, one person in the chat relayed their personal story and has done really, really well and wants some skin removal surgery, or we call that body sculpting surgery. And you can just contact our plastic, if you're one of our patients, we can refer you over to our plastic surgery department. If you're not with Wes, you can also just see them without a referral. And that's what I'd recommend. They do a great job with doing that if you're interested in it. Dr. Feng, several people have asked some specific questions like, hey, I've got this personal history like heart disease, I've got this particular one. And how often do we have to exclude somebody from surgery from a medical perspective?
Very rarely. I would say very rarely. Now, we work closely with all of your other doctors to, communicate about, how to best optimize your other medical problems going into this surgery so we can get you as good as, we can tune you up for to decrease your risks. And then afterwards, we also, keep in contact with them or help you keep in contact with them to help manage everything, as you are recovering from surgery. I would say for those patients on here who have specific medical problems, such as, previous heart disease or blood disorders, again, it's highly individualized. It's very difficult to make blanket statements. And as Dr. Gutnick alluded to, very rarely do we say, oh, you don't qualify. So I encourage you guys to make an appointment with us so we can really do a deep dive into your individual history and examine your medical record and see, what is the best option for you and what is the best route to go. So I do encourage you guys to do that because, yeah, we tend to, at the Cleveland Clinic, especially, here, we get a lot of patients with a lot of other medical problems. It's the #1 heart center. And so just, throwing out the heart disease issue, there's lots of patients who are, even on heart assisted devices, things that pump blood for their heart. And we operate even on those patients. And so we have published data series on those patients. So, we do our best to, do our best for all of our patients.
Yeah, I'll say for myself, I probably have about one person a year that I say, I think you're probably not a candidate because of your other medical problems. Now, it's not uncommon for me to say you need to be tuned up before you're ready, but probably about one person a year. And when I have that, what I do is I send them to another surgeon just to make sure that I'm not missing something for them to get a second opinion on that, just to make sure. So it happens occasionally, but it's uncommon. But it is fairly common to say, hey, look, I don't think you're quite ready. I think if we get this, and this done, and most people are able to do those things. Often it's getting some heart issue more under control, for example. Sometimes it's somebody that has really severe untreated sleep apnea. That's actually probably the most common. If you have untreated severe sleep apnea, we really do need to get that under control for the safety of the anesthesia when you get surgery. Again, Jamie, most common question, how long does the process take?
Yeah. So, in terms of prior to bariatric surgery, the actual process is more dependent on what your insurance requirement is. So we got to kind of work with what your insurance is telling you that they will, they need you to do in order to actually have them pay for the bariatric surgery. So some patients have a 6 months of medically supervised weight loss where they're meeting with one of our dietitians or one of our obesity medicine providers each month, and just kind of going through talking about some of the changes that they're already making, that kind of a thing. And it has to be documented in a visit. Other people, they don't have any kind of requirement in terms of what their insurance specifies, and they just have to meet what our medical or our evaluation requirements are. So they kind of got to get all those boxes checked off by each of those 4 providers within our team, and then they're good to go. In general, it can be between a 3 to 6 month process, but it's a lot of it is self-driven too. So as long as you're keeping your appointments, you're communicating with the team, those types of things, those patients tend to get through the process a little bit sooner or the most efficiently as per what their insurance requirement is. And then the patients that kind of maybe miss appointments, or they don't follow up, or they're not checking their MyChart to see if there's any kind of test results or next steps kind of a thing, those patients sometimes can take a little bit longer to get through the process. So we always just recommend communication is like the biggest and best way to get you through this program. If we don't hear from you, we think everything's okay. And so that's the before the surgical process. After surgery, for me, it was 4 weeks of me just being at home by myself and taking care of myself, which was kind of nice. And then I went back to work and I filed FMLA paperwork. My surgeon's team actually helped me file that, and I had no issues with that.
Yeah, I'll just spin off of that a little bit. One of the most questions we were asked that wasn't asked today is how do I get the time off of work and that kind
And
of
so
thing.
I was commenting on it a little bit.
Yeah, and thanks for mentioning it. And any of your surgeons will fill that paperwork out for you. Some of it you have to fill out because it's stuff that only you know about yourself. And then the medical parts we fill out. And it's always good to get that ahead of time from your work. Another common question is I thought I just needed a letter and just talk to your work because they'll tell you what you need. Usually if you're employed by someone that has like 20 employees or less, it's a letter. If it's much more than that, they typically have paperwork that they require. And with that, I think we've reached the 1 p.m. mark. There was a couple questions we didn't get to, but I think we covered almost all of them. Thank you again to the panel for being here today. Thank you to everybody who came and sent in some great questions. We really appreciate it. If you do have more questions, there's also on our website a recorded seminar that's actually a little bit different from this one and goes into a little bit more nitty gritty to watch. And of course, for particular questions about your particular medical situation, the best way is to just make an appointment so that we can answer those particular things. So thanks again, and everybody enjoy their afternoon.
Bye. Thank you.